Assalamu alaikum, everyone, and welcome to the webinar. I'm your host, the moderator. I'm honored to be moderating this important conversation, which is breaking habits, understanding and preventing substance use. This discussion brings together perspective from psychology, education, and medicine to explore the root cause of substance use, the impact it has on the youth, and what we as educators and parents can do to, resolve these issues. So, in the team and the panelists, we have Halima Noon. She's a clinical psychologist and addiction specialist. She's having an experience of 9 years. And then we have Dr. Ahmad Sarim Aziz. He's MBBS doctor, gold medalist, entrepreneur, and social worker. So, and also the alumni of the City School. We're proud to have you here, Dr. Ahmad Sarim. And then we have Sukaina Abbas. She's an educator. She's working as a SM at PAF chapter, and she's also an alumni of the City School. So we will begin the discussion with Halima. Thank you, Halima, for joining us today.
Thank you so much for having me.
Let's start with you from the psychological perspective, from your experience. What are some psychological reasons that actually lead students to engage in harmful habits like substance use?
Okay, so Afsha, when we talk about substance use, we have to classify it as a mental health disorder on its own, just like it's classified in the DSM, the Diagnostic and Statistical Manual of Disorders. So when we do that, the first psychological trigger, the main thing that we talk about is childhood trauma. Okay, so when we talk about childhood trauma, we talk about unresolved emotional wounds of the child in the form of, let's say, neglect, abuse, abandonment, lack of emotional support. All of these things are there. So when they're there at this point, substances are being used as a means to self-medicate, to numb out the pain, to as a form of escape, as a form of coping, as a form of connecting to something in particular, right? So the more frequently the substance is being used, the higher your tolerance level is. When the higher the tolerance level is, it eventually will lead you to dependency. This means biological dependency, psychological dependency, and social dependency, which is why addiction is categorized as a biopsychosocial disease.
So that's the fact to cope. That's the coping mechanism for the students, to use these substance. Okay,
Absolutely.
so
Other than
so
that, you have these. Please say something.
yeah. Please continue.
So other than that, you have these certain personality traits also that you need to keep in mind. You have sensation seeking, you have risk taking, you have aggression that of course, leads you to using more and you put you more at risk. Other than that, psychopathology wise, you can look at mental health disorders like bipolar, ADHD, PTSD. All of these things need to be taken account because when you have these certain disorders, your reward systems will be more enhanced and you are more prone to being addicted to certain substances.
Understandable. So it can come later, any time in age. We can suffer from such an issues like.
Afsha, the thing is that
Our,
trauma is
it's
always, when we talk about addiction, we always talk about trauma. So when there's substances involved, there's some sort of trauma present. People generally these days don't offer, young adolescents don't offer use substances just for fun anymore. They're always using it as a sense of belonging, as a sense of connecting, as a sense of escaping for, let's say, academic pressures, family conflicts, and related factors.
and so it's a peer pressure and all that as well. So
But
yeah,
at the back end, there always some sort of trauma present that's
yeah.
leading you towards filling that void, like I said, self-medicating as a means of a coping mechanism.
Understandable. So, Sarim, I would like you to please share from the medical perspective, what are some physical or health related effects of substance that students use and they might not realize at this point in time,
Okay.
and later they can develop such issues.
Okay. Thank you so much for the opportunity. I hope I'm audible. Am I audible?
Yes, it's
Yeah.
clear.
So Miss Halima has been very comprehensive about why substance use is being done in the first place. So first of all, let's be very real. Most young people try a substance thinking it's just one puff, it's just one pill, it's just
Yeah.
for fun. But here's the truth that you probably won't hear on social media. Substance use actually rewires your brain permanently, not dramatically, not instantly, not quietly. Not instantly, but quietly and silently, and that's the scariest part. So, for the young people who are listening me, imagine your brain is a high tech control room. Okay, so it's handling your emotions, it's handling your memory, your decision making, even how you feel, your joy, your sadness. Now, when you introduce a substance like weed, crystal meth, ice, vaping, cough syrup, or whatever is cool nowadays, so it walks in like a hacker. At first, it will make you feel good. It will release all that dopamine. It will send you in a cascade of energy and an escape. But what you don't see is behind the scenes, it's damaging your reward system. Eventually, like Miss Halima said, that you will start needing more just to feel normal. You stop enjoying regular things, music, food, and even your friends, and your sleep gets disturbed, focus drops, your ability to feel real happiness, it's hijacked. So you asked about a medical point of view, right? So I would
Yeah.
classify it in three term effects. So you have acute effects, you have short term effects, and you have long term effects. So every there's been a lot of information about short term and long term effects, but I want to stress particularly on the acute effects as well. um, so when someone takes a substance, so there's a concept of good trip and bad trip. So good trip is when you take a substance and it gives you euphoria and you have that dopamine rush and you're going and you're having fun, right? But most people don't talk about the bad trip aspect. So every substance, especially the stimulants and the hallucinogens, they have a potential to give you a bad trip. So what happens in a bad trip is we have people who go through an acute anxiety attack. People come to the ER with respiratory depression. People go into psychosis. There have been cases of people jumping off buildings. They don't know what's happening because they've just had a hallucinogen, and the reality is distorted. So they end up taking their own lives, uh, just having a bad trip. And I've personally seen cases where people have overdosed. They took the hallucinogen and they sometime during the trip they vomited and ingested it. And when a person ingests it, it's called aspiration. Okay, it takes your life in a few minutes. So, and most of the patient who reach the ER by the time they've already passed away. So, a majority of them are unfortunately young people. So they don't know what the acute effects are. एक दोस्त तो पकड़ा देगा कि चलो कोई नहीं यार ये लगा के देखो ये LSD है ये weed है आप एक लगा के देख लें, but it can send you spiraling down the death chain. Then the short-term effects, just like Ms. Halima said, you have mood swings, anger issues, weight loss, or risky behavior. People give you substances as a mean to escape depression, but in, uh, in, in reality,
It is
it
actually creating the
actually
depression
tends
and
to build
leading you to work.
depression. And depression creeps in, anxiety becomes your default. And long term, you're looking at permanent brain damage. So there've been cases of people having permanent brain damage, paranoia. We have people having heart attacks at age of 22, even sudden death. So the drug will eventually it will start destroying your immune system, and any minor infection becomes very life threatening. And an important last fact: the brain doesn't fully develop until it's 25. So every hit you take before that is damaging your brain, and that hasn't even started finished building. Okay, so if someone says ke ek laga lo koi kuch nahi hoga isse, तो tell them you rather protect the only brain you have, कि तुम्हारे पास तो दिमाग नहीं है, मेरा जो है उसको मैं बचाना चाह रहा हूँ, because I don't have a backup. So yeah,
It's better to avoid it, you know.
it is. It
So,
is.
yeah. So, thank you very much, Sarim, for sharing the medical perspective. Sukaina, you are working very closely with the students every day since you were heading the PAP chapter. So, tell me what kind of behavior changes or warning signs do you think that the teachers or the school leaders should watch and notice all the time?
Thank you for having me here, Afsha. The first thing that you should realize is that it shouldn't be that only adolescents are doing it. This acceptance, one of the things is this acceptance starts a lot earlier than teenagers.
Absolutely.
So what we're watching is we're watching our fathers, our uncles. They're smoking. The big brothers are vaping, and all of these things. It's all a culture that's continuing, and it's coming on earlier through videos and social media. So one of the things that is very, very important for school teachers to do is to train them. Teacher training is very important to watch out for substance abuse, because usually teachers do identify that there's a drop in academic performance, and
Okay.
then there's
This
also
is one thing. That's
frequent
the only
absenteeism or tardism.
time. Okay.
But that's usually related to other subjects. Like it could be a lot of factors. But however, one of the things that is the student is very lethargic. There are frequent trips to the bathroom. There's red eyes, change in health or weight loss, and then you've got like the student just doesn't keep on caring about what he's looking like, what grooming and hygiene, and again, then obviously one of the things that we do is that we keep on checking the students regularly and monitoring them.
This is essential.
So that is one thing that this is one thing that we can identify the warning signs.
Okay. So, Halima, in your experience, what do you think? What are some emotional or psychological triggers that can push students towards using such harmful choices? And what are the early signs, do you think, so that we should look into the students or in the generation that coming up?
Right. So, as Ms. Sukaina just very nicely explained, the first couple of things that you should keep in mind is number one, is a child showing any sort of problems at work or school? How is he behaving? How is he being? Is he frequently missing school or classes? Is there like a sudden disinterest in school activities? Is there like a sudden drop of grades or work performance? So we have to look at that. The second pointer, like Mr. Kenna also explained very nicely, is physical health issues, lack of energy, lack of motivation, weight loss, or even weight gain in certain substances, red, puffy eyes, neglected appearance, you can't miss. There's lack of interest in clothing, dressing up, grooming, how the person, how the child looks. Changes in behavior is one very important factor that we need to consider. For example, exaggerated efforts to bar family members from entering their room, or being a little secretive
Yeah.
about where they're going, what they're talking about when they're talking to their friends, or drastic changes in behavior or in relationships with family, unstable mood. You have lows, you have highs, you have all of those. And very most importantly, money issues. Sudden requests of money without any reasonable explanation, or discovering that money is being missing from the house, or things are being stolen from the house, or items have disappeared from your home. These are the main ones that one needs to consider. And
So
talking
we
about
as
some of
parents should keep
yeah,
we as a parent should keep a check on such activities, what
absolutely, absolutely. These are the few main points that one needs to look out for.
Can I add to this, please? One of the one of the money things, as Ms. Halima just pointed out, the students basically what they do is that they don't eat their lunch, keep their money for buying these drugs and these substances, and then when they come back home, they're extremely hungry. So there's an increase
Okay.
in hunger because they're not eating their lunch. The money is being saved for the substances. This is one place where the parents can monitor.
Yes, absolutely.
So we have been discussing the issues, and I just really need to know the problem, the solutions that how we can cater such issues. So, Sarim, what advice do you have for the youth?
Okay. So I'll talk about what I'm best at at the Youth Led Initiatives. So um, सबसे पहले तो I would like to appreciate the both speakers. They were very comprehensive on why early intervention is important. So they were quite right. It's life saving, and I would just like to add one thing to what they said. So addiction, I always say addiction is like termites in a wood, deemak ki tarah. So you don't see it from the outside, but inside it's working is slowly hollowing everything out. And by the time things become obvious, damage has already been done. So they've been very comprehensive about it. Parents and teachers, they should be looking out for any sudden mood changes, any um, a student who was very active before, but now the student is spending too much time alone in isolation, dropping grades, red eyes, as Ms. Sukaina said, sleep disturbances, and a different vibe that the student is feeling kind of off. Okay, so I'll talk about what I did, and in hope that people and students can take it up. So I didn't grow up in Lahore or Karachi or Islamabad. I came from a small city in South Punjab, where we didn't have any fancy exposure, career counseling. We didn't have the CAPS department back then, even if we did. So it wasn't working. We didn't know about it. Okay, and so frustration was something. I was frustrated at the problems I saw around me. So I turned that frustration into fuel, started a food philanthropy movement, built mobile vans, and worked with nonprofits, and all from a small town, no connections, just one dream to be useful. So the students who use substance might be struggling with identity, peer pressure, or feeling like they're not enough. So let me say this very clearly to all the students: you are more than enough. You just haven't found your mission yet. So not everyone has to start an NGO. Maybe your thing is painting, or coding, or organizing events, or even helping your classmates feel seen. So whatever it is, I want the students to channel their chaos into creativity. That's how you heal, that's how you grow. And the students must remember that peer pressure only works if you don't know who you are. So you have to find your voice, and the world will hear. So whenever you're struggling with identity or peer pressure, ask yourself, I always say this to students, who do I want to become? Not what your friends want, not what's trendy, not what's feel true, but who they do they want to be. They need to find their spark, and trust me, if you find that spark, that high is going to be better than any drugs that people offer. So students have a lot of creative avenues, especially those who come from large cities. So they can participate in MUNs. That's a very good exercise. They can participate they can volunteer with a lot of social NGOs that allows you to find your inner purpose. So yeah, these are some of the things they could do.
Yes, and I think that journal counseling is also very important, Sukaina. And at the school level, you can talk with the students about this topic very oftenly. And we have to create
Exactly.
an awareness that these are the problems and we should solve them. I'm sure we will be creating such an supportive environment in the campuses as well. Would you like to say anything about it?
Yes.
Well,
One
this
thing.
is
Sorry, Miss. I was just adding one thing, if I get your permission. Yeah.
go ahead.
So
Yeah, yeah.
yeah, okay. So one thing I've learned while working in the community is that we are very great at labeling people, but we are very terrible at listening to them. So there comes the counseling part
Exactly.
where we need to understand the new norms. We need to understand that there's a common misconception regarding substance use. के substance use वही लोग करते हैं जो criminals हों, जो backbenchers हों या dropouts हों, bad families से हों. But I've met people who've had 90% in board exams, who've led the debates, who've been prominent members of the student council, and they've been doing that, right? So it's not about a good or bad person. The drug will care that you're hurting, you're lonely, or you're curious, and it uses that window to walk in. So that is the reason we need to start these early interventions right at home and at the school, where most of the people find the gateway to all these drugs. Yeah.
So counseling is essential. It is important. And I think we're judging people. And so it's better not to judge people, just talk to them, listen to their issues. Yes, Sukaina, you were about to say something?
Yes. One thing I found as a educationist and as a parent as well, since I have a 15-year-old, that counseling and awareness is essential. Uh, my son was in a school where his the awareness started around the age of 8. They started educating around grade 3 and grade 4 about drugs use, substance abuse, internet, digital policies, and safety, internet safety. So he knew quite a lot about it, and he knew his priorities. That this is what I found when I was also counseling teenagers. Because once you have an open dialogue with them, if they trust you as a teacher, as a mentor, then they will come and confess to you directly as soon as they use the substance. Because I've had these incidents. The moment they used it, they came to me at once and they talked about it, and we counseled them. Since at the city school, we also have guidance counselors. So there we can refer it to them. But again, we do have guidance counselors, but there has to be an open dialogue between the teachers and the students, and a relationship of trust that is very essential, so that it can be identified and they can admit to it before you to come before.
And I think they should have mentors at school and they should
So
talk
one
to
of
them, and
the
the
counselors
mentors
is
should give them
absolutely
a good
essential.
idea. Yeah, yeah,
Yes,
they're praying this too. Yes, exactly. So, Halima, I would like you to please
mentorship
give
programs should
us,
be and awareness programs as well.
yeah, we should be introducing them and engaging students in such productive activities, I guess. So, Halima, what do you think? What can students do in their daily life to manage their stress in healthier ways? So, everyone is facing a lot of stress these days. Students have a stress of exam and a lot of even at home and peer pressure and a lot of stuff. So how they can manage it in healthier ways? What do you think?
Well, one thing that works for my clients is that they start working on daily inventories. They start working on daily emotional check-ins, rating their stress levels, and like how am I feeling? What they rate my stress level from 1 to 10. So in this way, the child is more self-aware about their psychological triggers, their social triggers, their and identifying triggers in general. Other than that, if you're having difficulty doing bigger, difficult tasks, just try to break them down into smaller steps, like to-do lists, planners, and more importantly, talk to somebody. Always talk to somebody. Talk to somebody
Yeah.
that you trust. It can be your friend, it can be your parent, it can be your teacher, it can be your counselor. Now, the thing is, people these days have difficulty asking for help. Just the mere act of I'm not doing okay, or I'm having a bad day, or please help me out. So that barrier is always there. So that is where we need to encourage the child, wherever you're having a bad day or you're stressed out, reach out and ask for help. We are there for you. Help will always be available. You see, asking for help, seeking support is a strength. It is not a sign of weakness. That is every single human being, even adults, need to understand. Other than that, back to the basics. Move your body, exercise, dance around, walk, yoga, 2 minutes deep breathing exercises. Your sleeping needs to be at least 7 to 8 hours of scheduled sleep, nutrition. Um, सबसे important, break from social media, break from screen
Yeah.
time, which no child is getting nowadays. I mean, the child doesn't even know how to spend time without any sort of high end dopamine or artificial stimulation. So the child needs to know how to process information, process emotions, and regulate their nervous system without having any sort of screen time or artificial stimulation otherwise. So these are the main points that I could come up
And
with
I
on this.
think this mobile using and all these digital platforms are also a type of addiction.
Yes, it is. It is. Unfortunately, it's not categorized yet, but I would definitely categorize phone addiction, internet addiction as in itself a mental health disorder on its own.
Because we just keep on watching the reels and scrolling the phone, and this is the normal practice that the students are doing.
Eventually, I think, Aksha, sooner or later, it will be categorized as one in the DSM. I'm pretty sure of that, considering how the generation now is becoming.
So, in a nutshell, we all should focus on healthier ways and positive pathways, and we should keep our students and our children in productive activities. To ensure that they should not take this side and stay on the positive pathway. So, Sarim, since you are running your own NGO and Sukaina, we are working very hardly on student profile building. What do you think? What other activities can we introduce, being the leaders for the students?
I think the first and foremost thing that schools and teachers they should focus on is counseling and therapy. That's very important, um, because we can only fight this by changing the way we talk, and we need to understand what's going behind the behavior. So we must normalize therapy and teach kids what substance is, what it does, and we must empower our schools to educate and not just punish students. The students should be told that it's no shame in asking for help, and it's asking for help is not a weakness, but rather it's a strength in its rawest and bravest form. And another thing, apart from introducing students to different social ventures and giving them opportunities to go do internships and everything, I think we know everything. We know all of the creative avenues that are available, and we should just try to like make those avenues accessible to students. And there's one thing, just while you guys were discussing, it just hit me that there's a new substance that's been out, and it's pretty common. And the scary part is that it has a rather acceptance. It's gained acceptance in our society. The use of vape, and it's pretty common in universities. I know for a fact that it's common in some schools as well. So uh, it's not seen probably seen by people as dangerous as cigarettes or other substances. But trust me, it's now the WHO has even made a term for vape use. It's called EVALI. So electric vape associated lung injury is a thing, and we are a generation of guinea pigs, and we don't know what it's going to do in the longer run. But there are cases of popcorn lungs, so it's kind of a lung disease that's happening in young people. So I think there should be a complete ban on e-cigarettes and vapes in schools as well, and students should be educated right now, because I see vape as a emerging pandemic. I don't know about if Miss Halima or Miss Sukaina they agree. I would like their comments
No, no,
on
100,
episode.
percent I agree with you on this. Because you see children as young as 11 and 12 who are doing it. I've seen it. And then they go to is these new coffee places like, I mean, I shouldn't name the coffee places, but they go to coffee places in Lahore, and then it's like a trend being there and, vaping and looking cool. And boys and girls both are doing it as young as 11 and 12. So, at an earlier age, you're opening that door for yourself. So I agree with you 100%, and
And
I
one
feel
of
like
the
some
reasons,
oriented classes should start as early as possible, because the younger the child is, the easier it is to break those habits. Now, if you identify substance use problem at the age of, let's say, in the 30s and 40s, it's just very difficult to go back, because that's like years and years of toxic, unhealthy behaviors going on.
And one more thing is accessibility, that it is accessible, available.
Yes,
So they've
absolutely.
made it very lucrative with all flavors. This is apple flavor.
Yes.
This is and
Yeah.
you know what? The flavors they're laced with heavy metals, formaldehyde, and very toxic substances. So although the flavors, they're actually masking how pathetic their formation is. So this needs to be made very clear to students. They think it's very cool, and but it's not cool actually. It's causing respiratory diseases in people who've been using it chronically, and I fear that the way it's being used, the way it's being generally accepted by everyone, it's going to have serious consequences in a few
And
years
long-term
probably.
impact. Yeah. So I would like to wrap up now here. So last
one of
advice,
the
anything to give to the students, to the generation, to everyone, I think, to the parents as well. Halima, will we
I
start
mean, I
with
I'd
think
you?
like
the
to say
first.
something about that.
Okay, yes, sure.
Sure. Yes, Sukena, would you
One
like
of
to
the
say
things is
something?
that parent monitoring is very important and parent awareness.
Okay.
Because when we're talking about parents, like you mentioned vape, and it might be nicotine free, again, then as Dr. Ahmed said, that it has a high level of metals and heavy metals. And generally, what our parents believe is that since it doesn't have nicotine or it's nicotine free, so it's fine and everyone can use it, it's harmless. So, one
So
of the
these are all the
crucial things that
assumptions.
we do for our school is parent awareness for substance and drug use. That is very, very important. And schools can lead with that.
Absolutely. That's our responsibility as a teacher, as a parent. That's because this is our community. We have to keep it safe. Yes, one last comments if Dr. Ahmad Sarim and Halima, if you have, please share it with us.
Well, we can start with better communication skills between parents, teachers, and the students. I feel like there's a barrier there, so the child is always very hesitant on speaking on about anything in particular. And especially normalizing mental health conversations is very important. You know, if there's stress at school, reach out and talk about it. If you're having a bad day, talk to the child, ask him how they're feeling, and make easy access to counselors in school. Have peer support groups there. And lastly, remove stigma of therapy. It's okay to ask for help. It's okay if you're not doing well. It's all right, you can reach out. Like I said, help is available in any form. Just reach out and speak about it, talk about it.
Perfect. And love yourself. Love
Yes,
yourself.
absolutely.
This is important. This is important. Yes, Sarim.
And be able to say no.
Yeah, it is also very
Listening
much.
skills, social skills, assertiveness skills, these need to be taught to the children. And वैसे भी अब तो other than trauma, young adolescents have this illusion of vulnerability. You know, nothing ever bad can happen to me. Nothing will ever happen to me. It won't happen to me. I'm okay. I'm invincible. So you know, young adults always have this sort of false perception कि हमें तो कुछ भी नहीं हो सकता. And change will only be possible unless something really bad happens, like a bad incident happens, like a drunk driving accident, or God forbid, a friend ODing, and sometimes not even then. So, this is the perception that needs to be worked on with adolescents. I'm saying that because I used to be one of them growing up, that nothing could ever possibly happen to me, and I'm sure you would feel that way also. So this is something that needs to be considered, because आपकी जो prefrontal cortex है, it's still developing. So if it's developing, then you're more prone to risk-taking behaviors, substance use, impulse control, decision making. All of that is compromised. So at this point, you need to have some sort of elders, experienced person who is there to guide you and help you out with it.
So basically, it has a worst effects psychologically and mentally and physically. So
Yes.
yes, Sarah.
Okay. So, to the students, if you're a student and you're feeling trapped, don't wait for things to explode. Whether it's your friend who's offering you pills or vape or cigarette to relax, or your cousin is saying कि ये तो सब लेते हैं, your life is valuable than any high. And to the parents and the siblings, if you find your child using, don't attack or accuse. Just sit down with them, listen, and just say, "Okay, we're here, hum idhar hi hain, and we'll figure this out together." Involving a doctor or a counselor early can prevent years of pain. So there's no harm in reaching out to a counselor, to a psychologist, to a psychiatrist. Let's just not wait for an unfortunate event. Let's just not wait for suicide attempts or hospital emergency visits to finally talk about it. So that's all.
Thank you very much, Sarim. Yes, Sukaina. One last comment or advice do
One
you
thing
have for
is
this
that
generation?
what I want to say to the students by themselves is that you are enough by yourself. You don't need anybody else's validation, or you don't need your friends or your peers to accept you. You should be enough for yourselves. You are the best version of yourself. So drugs, using those substances is not going to make you more cool. So this is something that should
Absolutely.
be reinforced regularly by the parents and by the school and by the teachers that also as well.
Absolutely. Agree with all of you. Thank you very much. Thank you very much, all of the panelists, to join us today. And I hope this conversation is going to be very useful for those who have listened to it and those who can use it later and can see it. So I believe that substance use is not just a personal issue, it's something that actually affecting the families, the classrooms, and the communities. So we all have to support one another, and we do not have to judge anyone. We have to care everyone. So thank you. Stay safe.
Thank you.
Allah Hafiz.
Thank you.